Hi guys, welcome back to Wellness Dimension. Today I have Alexandra Bergbauer with me, and we are in the topic of massage therapy. How are you today?
I'm good. How are you doing?
Good, thank you so much. Can you please tell the audience who you are, what you do, and a little bit about this topic?
Yeah, so hi, I'm Alexandra Bergbauer. I'm based in Boca Raton, Florida, and I'm a massage therapist. I've been one for over 15 years now, and right now I'm um, currently just focusing on prenatal, postpartum health, um, and just seeing, yeah, a lot of women and yeah, I love it. I love what I do. And I love helping out, like especially like my pregnant mamas, like because they're always coming in for, for low back pain, you know, calf calf cramps and yeah, so I try and help all that. So yeah, that keeps me busy.
Sounds pretty fun. So could you tell us what are some of the benefits to massage therapy, specifically for women when it comes to pregnancy and as well as postpartum as well?
Of course. Yeah, though there's so many benefits. Yeah, when I see like my pregnant mamas come in and then when they come out of the room, they're like, "Oh, thank you so much. I feel so much relief." Because yeah, they come in and the low back, especially as the belly grows bigger, it puts like more strain on the low back. So just to be lying down and especially face down because I have the pregnancy pillow, so they're able to lay face down comfortably and safely. And yeah, that actually takes pressure off the low back, and then I can do some stretching, some massage, targeting the low back to try and help release it, as well as like the cramps they get in the calves. Let's see what else. Some have like tailbone pain and all that. Like I focus mainly on the low back.
Okay, so would you say that you doing the massage therapy helps alleviate some of the anxiety and the pain that comes with labor and also carrying pregnancy as well as managing some of that pain?
Yes, definitely managing a lot of the pregnancy symptoms, and I also do induction massage, which is acupressure for the induction points on the body. So like I can tell you like the one right here between the webbing of the hand, that's a pressure point. On the inside of the ankle, from the ankle bone, four fingers up is another pressure point, and that's directly for the uterus. So I usually do that beginning at like 38 weeks. So like the moms come in and they say, I want to try the induction points to get things going, especially because they're scheduled for induction and they'd want to do something. They want it to come more naturally.
Right.
So yeah, I try to do all the acupressure points to um, help move it along.
Okay. So, I know you said you've been doing the massage therapy for 15 years. So, were you working in different areas before in general outside of labor and pregnancy also?
Oh yes, I was. Yeah, I started working like at a salon, and I've moved like around. Like I did chair massage. I still kind of do. I do a lot of uh office visits. So I go to offices with my chair massage and like massage all the employees, and that's always
Okay.
fun.
So would
But
you
yeah,
say that it serves as a substitute sometimes for medication or maybe like fitness or people who are not able to perform as well in their physical abilities? Would you say that massage therapy comes in pretty handy for these type of people?
oh yeah, definitely. I would say massage is very complimentary, and it would definitely help people like with anxiety or with any illnesses or like physical ailments as well. But yeah, it's because yeah, massage is just very, very, very relaxing, and like I even recommend it too because I have anxiety as well, and I try to get my massages frequently as I can because it does really help. And as physically, yes, it's like it's the best really. But yeah,
So
so I would always recommend.
do you ever get clients who are referenced to you by like a practitioner or maybe their doctor or some sort of professional as well?
Definitely, yeah. Like it's mostly like the midwives or the OBs, chiropractors as well that I'll get referrals from, and then also from past clients, like they'll refer me, their friends and family. So, but yeah, that's always good.
I'm curious to know what got you into massage therapy. What was your experience actually moving towards this type of work? And because I know it's a lot on you as well, being there physically and using your hands and trying to work with the client, whether they're in pain or, they have some sort of mobility issue. So, what was your experience actually getting into it and working all the way up till now, being a prenatal massage therapist?
So I've always had low chronic back pain, like from mid to low back, and I've always had it since I was a teenager. And really, the only thing that helped was massage. And I was always interested in the medical field. I actually went to a naturopathic school up in Washington State. I was in, I tried for a year. I was like, not really my thing. Then I came back home and I started to think, well, what else do I enjoy? Well, what else would I enjoy doing? And I remembered, oh, what really helped because I still wanted to help people, and what really helped me was massage. So I decided to enroll in massage school, and yeah, I loved it so much. Graduated, became licensed, and now I work. Now it's been over 15 years since I've started working, and yeah, I've worked like at a salon. I've done like at the mall doing chair massage, uh, and and like franchises too, like the massage franchises. I've been on my own. I've done mobile massage, and then now I'm working at a prenatal clinic. So
Awesome. That seems like the journey, but I'm glad you found the actual area that you enjoy and you feel like you're helping the most. And I believe that women definitely could use you in such a event like giving labor. So that's awesome to hear.
oh,
Well,
thank you. Yeah, and then
sorry, go ahead.
oh, well, I was gonna say when how I got into the how I got into prenatal massage was I was doing because I basically wanted to do like regular massage, like when I first started out, and then one of my first clients, she became pregnant, and I was like, oh, that might be cool. So I started to learn more about prenatal massage because I wanted to continue helping her, and that's pretty much where it started, where I wanted to do mostly prenatal. And so after that, like yeah, after 10 years of doing massage, I finally and after having my own little girl, uh, I found this place in Delray where I'm working now. They were hiring a massage therapist, and I went, interviewed, and I loved it. They loved me, so I was like, okay. So it was a perfect fit.
So what would you say to my audience who may be a little more, on the I don't think so side when it comes to massages for pain management, or they rather take medication to these sort of things? What would you recommend them to know about what you do and the benefits of it?
Well, I would definitely recommend try at least trying it, and definitely see how it goes. It's very complimentary, and there's so many massage therapists out there, but and I would definitely recommend going to someone who is licensed and certified, because there's so many people out there who say they do massage, and they're not licensed or anything. So no shady stuff. But yeah, definitely go to somebody who's certified, especially for prenatal, because I've had clients come to me and they say, "Oh, this is so much better. I went to, like one of the franchises or something. They booked a prenatal. They get there, and the massage therapist doesn't want to touch them because they're afraid." And that's the one of the problems that I've seen, that a lot of therapists are afraid to touch pregnant women when really you're not going to do anything, especially in the first trimester. You know, you're not going to cause a miscarriage, and it's fine. But that's why it's best to find somebody who is certified and who has experience doing it, and that way, like, you'll feel more confident and you'll know you're safe with them. But yeah, because
Right.
I've had like a lot of women complain and like, oh, they go there and they feel strange, like they look that they've said massage therapists have looked at them and like they're like scared.
Oh, wow.
But yeah,
So,
no, nobody should feel like
what are some things that you've learned while getting licensed? I know you mentioned you do the points and things like that. I'm sure that you have to learn the muscles and some sort of movements as well as positions in the body. So, can you tell us just a little bit about that for us to learn?
Of course, yeah, yeah. We definitely learn we learn everything about the body, muscles, nerves, organs, like pretty much everything. And yeah, and of course kinesiology, which is like, the movement of muscles and everything. So that way we know like what to stretch and what could be, like if your back is hurting, which muscles might be uh, might be hurting, or what's the word? I can't think of the word. Uh,
Like
drawing a blank.
spasms, things like that.
Also, yeah, that are spasming, or they're um, no, I can't think of the word. But yeah, like, muscles that are, causing pain, or pain that's coming from like referred, like, oh, if it's back pain, but it's actually coming from like your your abdomen. Like if your
Right.
abs are tight, right, then the back can be tight. So yeah.
Okay. So yeah, I definitely wanted to have you on because I know there's a lot of stigma when it comes to massages and the actual certifications and how it can be helpful along with pain medication, along with physical therapy and all these different treatments. So I definitely wanted to hear your experience, especially as a prenatal, and how you've helped so many people throughout the years. So, thank you so much for coming and sharing with us today.
Oh, of course. Well, thank you for having me on.
No problem. Thank you.